Good day. This is Group 1 from Block 1045L, and we are going to talk about three types of medical devices, namely ophthalmic drops, otic drops, and nasal sprays. We are also going to tackle a new medical device called photodynamic therapy. Let's begin. Ophthalmic drops or saline-containing drops used as an ocular route to administer. This medication may be used to treat eye infections. This product may contain neomycin, bacitracin, and polymyxin antibiotics that work by stopping the growth of bacteria. An ophthalmic drop is composed of two parts: the dropper, which assists in the delivery of the medication, and the bottle, which holds the article and is or may be in direct contact with the article. Some of the applications of an ophthalmic drop include treatment for bacterial, fungal, and viral infections, conjunctivitis, elevated intraocular pressure and glaucoma, re-wetting contact lenses, and soothing dry or red eyes. To administer ophthalmic drops, first you must ensure that you have washed your hands before applying the medication or even before touching your eyes. Then, tilt your head back slightly and look up. It might help you to look up towards a specific point above. Next, use one hand to pull down your lower eyelid. This is to let the lower eyelid form a shape of a pocket which may catch the drop. Next, squeeze sufficient amount of the drops into the eye. Take note of instructions given by your doctor, most especially when it comes to the number of drops. Close your eyes and apply gentle pressure to your tear ducts or where the eyelid would meet the nose, and hold the tear ducts for 1 to 2 minutes, or unless advised by your doctor not to or to do so for longer. If any drops leak out after releasing the tear ducts, wipe them away with a clean cloth or tissue. Here are some do's and don'ts when using an ophthalmic drop. First, do know how long your eye drops can be safely used. Next, if you're using two types of eye medications, do use them in the proper order. Next, do understand it's normal for some liquid to flow onto the skin around your eyes after using an eye drop. Now to the don'ts. Don't allow the dropper tip to touch your eye or any other surface. Don't wear contact lenses while applying medicated eye drops, and never share eye drops with another person. Next up is otic drops. An otic drop is a drug delivery device which is used to treat or prevent various ear infections or even aid the removal or loosening of earwax. Not all are over the counter and are simply used for short-term treatment. An otic drop has two parts: the dropper, which assists in the delivery of the formulation, and the bottle, which holds the article and is maybe in direct contact with the article itself. Here are some of its applications. It can be used to treat ear infections, relieve pain, congestion, and swelling caused by middle ear inflammation, and it can also be used to remove earwax. In using the otic drops, there are two phases. First is the preparation phase, and the second one is the administration phase. For the preparation phase, you must first gather the materials you would need: the otic drops you are to administer, tissue or a piece of cloth to wipe away excess drops, and alcohol or hand sanitizer to clean your hands prior to administration. Second, wash your hands thoroughly with soap and water. However, you may also use alcohol or hand sanitizer as a substitute or in addition to washing your hands. Third, warm the eardrops simply by holding it in your hands for 1 to 2 minutes. The purpose of this is to minimize discomfort for the patient caused by the cold liquid added directly into the ear. For the fourth step of the preparation phase, you must remove the cap of the bottle and place the cap on a clean and dry surface to avoid contamination. Lastly, ensure that the dropper is clean. For eardrops with separate droppers, ensure that the dropper is clean, uncracked, and unchipped. This is to avoid contamination and to ensure an even dose, since chipped droppers produce larger drops than intended. For the administration phase, first, you must position the patient's head in a way that the ear is facing upward. When administering the drops to yourself, it may be easier to sit down or stand upright and tilt your head to the side. When administering the drops to others, it would be best to let the person lie down on their side. For adults, you would want to gently pull the upper ear upward and back, and for children, you would want to gently pull the lower part of the ear down and back. If the bottle has a separated dropper, draw some of the medication into the dropper. For eardrops with their own dropper tip, you would simply need to slowly point the dropper tip into the ear and gently squeeze. Squeeze sufficient amount of drops into the ear. Take note of instructions given by your doctor, most especially when it comes to the number of drops and for how long you would allow the medication to sit within the ear. Gently pull the patient's earlobe up and down to maximize the flow of the drops within the ear and keep the head tilted for about 2 to 5 minutes, otherwise refer to the doctor's instructions. Wipe away excess drops or overflow with a clean cloth or tissue, then wipe away excess medicine on the tip of the dropper if any. Put the cap back onto the bottle and make sure to tightly close. Then wash off excess medication that came in contact with your hands if there is any, then store the bottle as directed within the label or package insert. Here are some important things you must take note of when using an Otic drop. First, don't use the dropper when cracked, chipped, or dirty. This is to minimize contamination and ensure even doses per drop. Next, don't allow the dropper tip to come in direct contact with the patient's ear, skin, or any unclean surface. This ensures that the tip is completely clean at all times to minimize contamination and the risk of infections. Third, when warming the drops, bathing or submerging the entire bottle into warm or hot water isn't necessary. This may even damage its contents. Fourth, don't share eardrops with anyone else. This is to minimize the risk of infection. Additionally, eardrops may introduce burn-like feeling or stings when applied. This isn't harmful and most of the time is not a cause of concern. However, if discomfort persists for 10 to 15 minutes, call your doctor. Now let's move on to the nasal spray. Nasal sprays are locally acting drugs such as decongestants for cold and allergy treatment whose systemic effects are usually minimal. Both solution and suspension formulations can be formulated into nasal sprays. Due to the availability of metered dose pumps and actuators, a nasal spray can deliver an exact dose from 25 to 200 micrometer. Here are the parts of a nasal spray. The cap serves as a protection cover to the device. The nozzle or actuator is used to break apart the liquid formulation or the drug into a spray pattern. The pump supports the actuator and delivers the formulation in the proper form to the chamber of the actuator. The spring is the mechanism by which the actuator retracts when pressure is released, returning the pump to the closed position. The dip tube extends from the pump down into the product and is the one that brings in the formulation from the container to the pump. Lastly, the bottle is the one that holds the article or the drug formulation. Some of the applications of a nasal spray include relieving congestion or stuffiness in the nose, relieving rhinitis symptoms, and adding moisture inside the nose to dissolve and soften thick or crusty mucus. There are two types of nasal sprays, namely pressurized canisters and pump bottles. For this specific demonstration, a pump bottle was utilized. First, gently blow your nose to clear it of mucus before using the medicine. Next, remove the cap, then shake the bottle. The first time you use the pump spray each day, you may have to prime it, squirting a few times into the air until a fine mist comes out. Then, tilt your head forward slightly, then breathe out slowly. Hold the pump bottle with your thumb at the bottom and your index and middle fingers on top. Use a finger on your other hand to close your nostril on the side not receiving the medicine. You may refer to the demonstration below. Squeeze the pump as you begin to breathe in slowly through your nose. Repeat these steps for the other nostril. If you are using more than one spray in each nostril, follow steps 2 through 5 again. Try not to sneeze or blow your nose just after using the spray. Here are some points to remember when using a nasal spray. First, it may take up to 2 weeks before noticing the full effects of a nasal spray. If you are using a pressurized canister, wash it at least once a week. Be sure that you can sniff air through each nostril before spraying, otherwise the medicine will be wasted because it will not go deep into the inside of your nose. Aim straight. Point the nozzle of the nasal spray container towards the back of your head. If you don't spray straight, you will waste the medicine and may cause more irritation in your nose. If the pump spray is used correctly, the spray should not drip from your nose or down the back of your throat. If your nose hurts, or if you begin to have nosebleeds, or if the inside of your nose stings, stop using the spray for 1 to 2 days. If the nosebleeds persist, you should opt to use a saline nasal spray instead. You can also use a cotton swab to spread the thin layer of petroleum jelly inside of your nose right after using the saline spray. If the bleeding or irritation continues, talk to your doctor. Photodynamic therapy, or also known as photochemotherapy or blue light therapy, is a type of treatment that uses light along with chemicals known as photosensitizers to treat cancer and other conditions. It is used in the treatment of cancer like actinic keratosis. It is also used to treat many different conditions including acne and skin growths like warts. This is because of how potent the chemicals can be in destroying the cells or glands that can cause these conditions. Photosensitizers can kill nearby cells when they come into contact with certain wavelengths of light, usually from a laser. This is because the light causes the photosensitizer to create an oxygen that's toxic to cancer cells or other cells being targeted. This process of killing cells by using both light and medication to create oxygen that's poisonous to cells is called phototoxicity. Photosensitizing agents, when taken intravenously, may also destroy blood vessels that feed the cancer cells. Major benefits of the photodynamic therapy include completely non-invasive. It is also a quick treatment with sessions ranging from 1 to 2 only. It also involves fast recovery. It is relatively painless and is less destructive. Photodynamic therapy is effective for the treatment of lung cancer, pancreatic cancer, cholangiocarcinoma, esophageal cancer, actinic keratosis, non-melanoma skin cancer, rosacea, facial wrinkles, sun damage, and age spots. There you have it. You have reached the end of the presentation, and I hope that you have learned a thing or two about some of the medical devices utilized in the medicinal industry. I hope that you took note of the important reminders we have given you when using these medical devices so that you will use them correctly. Once again, this is Group 1 from Block 1045L. Thank you for listening and have a nice day.